Hello everyone, welcome to this special program on CGTM. I'm Zhongshi. When we talk about cancer, we're not only talking about a disease, but about people, families, and life-changing moments. Every breakthrough carries the hopes of countless patients and their families. And that leads us to one simple but very important question. How can innovation and humanity come together to improve cancer care? Today we bring you together medical professionals from China, Europe, and beyond to discuss the future of cancer treatment and how we move forward together. Now, without much further ado, a warm welcome to my guests today. Joining us online, Dr. Robin Jones from the Royal Marsden Cancer Center, Dr. Sandra Strauss from University College London Hospitals, Dr. Silvia Stacchiati from the National Cancer Institute in Milan, Dr. Herbert Long from the Chinese University of Hong Kong, and Dr. Emanuela Palmerini from the University of Miami. And of course, here with me in Beijing are Dr. Wei Ran and Dr. Xie Lu from Peking University People's Hospital. And we also have Dr. Niu Xiaohui from Beijing Jishuitan Hospital. Thank you all for joining me today. And for the first part of our discussions today, I do want to start off with the human aspect of the conversation. Dr. Wei, why don't we start with you? For most patients, a diagnosis of cancer is a cruel reality, a blow to their life. What do you think can be better communicated to the patients?
When I explain the diagnosis to the patient, to the cancer patient, I have to use a very simple word. At that moment, if it's at a very early stage, I will tell him that it can be cured. It can be cured if we treat it very positively. But on the other hand, maybe if it's in a very late stage or an advanced stage, and maybe I will just comfort and to tell him several ways, and to tell his family members to just support, to be supportive.
And for those of us who are not medically sophisticated enough, what exactly is happening with your body when cancer develops? Dr. Palmerini, can I bring you into the conversation now? I mean, I'm sure you've had a lot of people ask you exactly what cancer is and have to explain it in simple ways that can relate to them. What would be a possible explanation that does just that?
I would use a word uncontrolled. So while our cells live in a balanced and controlled way, the cancer cells, they just grow uncontrolled. So there are no signal that let the growth of the cells taken care of. So I would describe to the patient that there are certainly some tumor that we can see in the CT scans, and I would go through the imaging together. But I would be very clear that usually what we see is the spike of the iceberg. And any tumor at the end of the day is in the bloodstream. So yeah, I would try to put the disease in this context so they would understand why we don't just get rid of what we see on a CT scan, on a PET.
Dr. Strauss, coming to you now, and correct me if I'm wrong here, I do feel that over the course of the last decade, when people hear the big C, it's not as scary, it's not as devastating because we've had new treatments, we've had new ways to deal with it. In your interactions with your patients, how do they cope and what determines how well they cope?
Okay, no, thank you. I think that's a very good question because you're right. There have been some really incredible advances in the management of cancer patients in the last decade or two. I think in terms of the principles, surgery is still the biggest and most important treatment for cancer. But for those who can't have surgery or for where the cancer has spread, then drug treatment is increasingly important. And that's really where there have been some incredible advances. And that's in part because we understand the biology, or what causes the cancer, or causes what Emanuela talked about, that uncontrolled growth of cells, better. So probably 10, 20 years ago, we developed treatments that could target a specific abnormality that was giving cancer cells messages to grow. And by being able to switch those messages off, the cancers could be controlled in a much better way. So that made a big leap forward. But the other huge change has been the use or the understanding of the immune system and using immunotherapy to treat cancers. Now, this doesn't work for all of them, but it's made a very big difference for lung and skin cancer particularly. And the reason I bring that up, because just to come back to answer your question, it's there's different ways of tackling cancer, and if you can cure it with surgery or multiple treatments, that's one thing. But the other side of it is cancer turning into something that may be more like a chronic disease or a chronic illness. So for having opportunities for patients to learn to live with cancer. So even if you can't get rid of it or cure it, some patients can live for many, many years with their cancer diagnosis. And I think that's been a really big change over the last couple of decades. You started by calling it the big C. Lots of people do think about it as the big C. It's still stigmatized. It's still a terrifying word to be said to patients. And therefore breaking it up and understanding that not all cancers are the same, and not all treatments are the same, and not all opportunities are the same for patients, then you can work with patients to kind of allow people to have the best quality of life for as long as possible, which may be for many years for some patients.
And it's our hope that programs like this can really tear down that stigma just a little bit and really instill that hope and that awareness into patients and people that care about cancer. Dr. Sia, I see you nodding just now. How do you prepare your patients for what could be a very sudden dose of difficult reality?
I think most of the fearness come from lack of knowledge. Because nowadays, for most sarcomas or other cancers, it can be curable. For those, it is just a part of the life, just the experience of the life. So I will take much time to explain to them the cause, the reason, and how we will do with the disease, because this is pediatric oncologists and the medical oncologists do. I will try my best to let them to notice this is a chronic disease, like Sanjam had told us about. But sometimes we will do everything we can do for the supportive life if it is really at the end stage of the disease. So the main thing for me is to explain everything to them. Just talk, and erase their fearness. So that's what we do.
That has to be an open and candid conversation with the patient always.
Yes, I want to be their friends.
Dr. Stacchiati, coming to you now. I mean, the challenges of coping with cancer obviously vary from country to country and from region to region. It also has to do with the healthcare system, the healthcare services that are available to a patient. What do you think are some common challenges shared across different countries or from different healthcare systems?
Oh, this is very good question. Yes, talking to a patient changes a lot according to the culture of the patient, meaning also the age of the patient, and clearly also based on what is available in an area compared to another. So I believe that for us, for example, we are treating sarcoma patient, meaning patient that can, from very young to very old, with different background and different living in different regions, is really not always easy to find the right words to talk to patient. Still, on average, I believe that what is important is to try to balance an accurate information with hope. We need to provide all patients, no matter the country, the age, the cultural background, hope. Hope is differently seen from patient to patient. For some patients, hope is like being able to be cured. For other patients, is like being able to have a good quality of life and not being left alone. This said, it's clear that there are areas where patients are discriminated because some drugs are not available in spite of them being effective, known to be active. And it's of course our responsibility to try to make all the drug potentially active available, but not only the drug, also services. For example, there are areas where pain is undertreated, and this is really, a shame in a way. So going back to your initial question, I believe that for a physician, for a medical oncologist, it's very important to have also psychological skills and the understanding of what is the expectation of a patient, meaning that we also need to have enough time during our visit to being able to talk of all of these to the patient we have in front of us.
Appreciate your answer. Thank you so much. I do want to move on to the second part of our discussions today about technology and its impact on both diagnosis and treatment. Innovation, technological advancements, especially artificial intelligence, are opening up new possibilities in oncology. I want to bring Dr. Niu into this. I mean, in terms of technology, how has that changed your medical practices with the patients? And in what way do you think your patients have benefited the most from technological advancements?
Yeah, I think that because technology changed the modern medicine nowadays. And a lot of things we depend on the technique. And now the modern technique can help you to make the precise diagnosis. That means we can find the real cause of a cancer, like the driver genes, and also we can, by the technique to produce the drug, just can target the precise change uncontrolled gene, and then we can treat the disease at the molecular level. And also, surgically, we have a robot and we have navigation. And the robot is some kind of with AI, and then they can automatically, very precise to get the surgical procedure fast, more precise. I don't know whether, because human being developed the technique and AI, and I don't know whether AI, what will, happen tomorrow. But actually nowadays, so also, we should to use the technology by the doctors also, and then we can make use the technique to help the patient, and also the technique just helps. So especially for the rare disease like sarcoma, so it's only 1% of all cancers. They get their AI idea from the biggest database. If rare disease do not have the big database, so I think so maybe the doctors involved in the sarcoma treatment still should be the major treatment group.
Dr. Long, coming to you now. Dr. Niu just now was preluding the potential for artificial intelligence. I want to get your take on this also. Help us broaden our imagination and horizon here. How will AI, how helpful and how powerful will AI be in medicine tomorrow?
That's a great question, and I think AI really is here to really help us treat our patients and help us in the entire patient journey. So from the initial diagnosis of the patient to the treatment of the patient, treatment planning, and then also really to be able to use AI to help us essentially harness big data and actually get all the treatment outcomes and treatment patterns of patients who have been treated and use machine learning to help us make better decisions in the future. So I think one of the greatest advantages really is, especially in our field of sarcoma, we're dealing with a rare type of cancer. And many a times, our own each personal experiences are relatively small because of the small patient volume. But the use of artificial intelligence and the incorporation of some of this machine learning, we're really able to enhance the knowledge base and also to be able to help us communicate with the various stakeholders in this sarcoma care itself. And I think the other advantage of artificial intelligence is prediction. And to be able to feed all the information that we already have from our existing patients and to be able to create different models in terms of, say, prognostication or treatment outcomes would be able to, again, make better decisions for our patients.
Dr. Jones, we appreciate your patience now coming to you. How can different regions better harness technology in advancing cancer prevention and treatment? Because obviously that's confined in a way to the varied levels of medical sophistication in different regions, their economic development phases. How do we bridge these differences and make sure nobody is left behind at this time of very rapid technological advancements?
Thank you so much. In a way, I think it links in with one of your previous questions regarding challenges shared across different countries and healthcare systems. And I think there's a huge potential for artificial intelligence and technology to really help the diagnosis and treatment of patients with rare cancers in particular. I think the introduction of artificial intelligence for pathology and radiology would be fantastic in our field, where centres outside of designated sarcoma centres can actually refer patients in, and the pathology and radiology can be reviewed in real time with the designated sarcoma centre. I think this will require a lot of input in terms of finances, as you mentioned, but I think that this will undoubtedly improve the treatment of cancer throughout the world, and particularly for patients with rare cancers. Following on from Herbert's point regarding actually collating all of these pieces of information together, I think that's absolutely essential so that we can all collaborate to actually better understand the biology of some of these very rare sarcomas, very rare cancers, and hopefully be able to develop better treatments for patients in the future as well.
Great answer. Dr. Palmarini, a very important question to you now. I mean, word out there is that in our lifetime, there could be a point where most, if not all, diseases are curable, thanks to how fast technology is developing. How do you see that prospect? Is that something that excites you? What about the limitations of technology as we see it fast evolve?
The possibility to cure all cancers, of course, excited us very much. And there was Umberto Veronesi that years ago told that breast cancer was going to be cured in 10 years. I think that there are, of course, differences in between cancer type as discussed, but the most important is the prevention and the control of all environmental factors as well. So I think technology might help to broaden and structure the way people proactively thinks about his health system. I'm thinking now to the, for example, there is an important colorectal cancer study that shows how structure physical exercise improves overall survival when added to surgery and adjuvant chemotherapy.
Thank you. And now I want to move on to the next part of our discussions today about collaboration and the future that we want for the people we love. Obviously, the reason we're having such a diverse panel today is that we want to pull the wisdom of medical professionals from different parts of the world and see for ourselves the collaboration that is in place and what more can we do to usher in even more cooperation in the future? Dr. Niu, I want to turn to you. Again, obviously you work with your colleagues and your peers from outside China as well. What can different regions learn from each other in terms of improving cancer care?
I think the first important thing is communication. So for communication, there are many ways. We should to go to somewhere and especially for rare cancer disease, for a rare disease like sarcoma. So, and we should learn outside face by face, and then we should attend the conference, and we should have the habit to read, the papers, and to communication. Yeah.
Dr. Jones, I wonder how much you value those exchanges, professional exchanges with your colleagues from China and also from other parts of the world. And in your past experiences, what have you been able to obtain from such medical exchanges?
Again, I think that's why events like this are so important. It's crucial to interact and to collaborate with researchers and doctors from all over the world, particularly in rare cancers. These diseases are so complex and so challenging to treat that it's important to get different points of view, different perspectives on the management of a particular disease. And it's great to work with colleagues from all over the world, so China, Asia, Europe, America, Africa, etc. It really is crucial. And again, particularly for rare cancers, the only way that we're going to really make progress in terms of understanding the biology and the treatment is to have international, worldwide collaborations. So I think this is wonderful, and I think taking part in events like this just encourages us all to collaborate and to interact and to try and improve things for all our patients.
Dr. Strauss, is collaboration already making a difference? Would you say, is there an example that you might shed light on where international cross-border collaboration is essential in finding better cures, better treatment plans for the good of the humanity?
Yeah, I mean, thank you for the question. I think collaboration is the only way to help us move forward with our patients. Again, working in such a rare cancer, we've been striving for decades and making very slow progress, partly because of the very small number of patients, the lack of biology, and lack of opportunities for our patients to access new drugs and clinical trials. So I think us in Europe, we've been working really hard to try and open up collaborations. I'm very delighted that China is now joining this endeavor. I think this is just one of many examples of how to make progress. We all have the same difficulties of treating the patients. Many of these things are very challenging, but that doesn't mean we shouldn't try and meet the challenge, because, I mean, just to finish where I started, collaboration is the only way that's going to make a significant outputs and increase the cure for patients, particularly with rare cancers such as sarcoma.
Why don't we have Dr. Stacchiati weigh in on this right now? I mean, to find time to share the results from your work, from your discipline, and to communicate with other doctors. How does that happen in your day-to-day operations, and what value do you see in that?
I believe that we could not survive without collaboration. We feel better because we can collaborate. We feel like we can move forward because we have people in our community that really want to work together, spending time even at night to overcome all the barriers we are facing. I believe that artificial intelligence can really help us in decreasing the amount of time we need to join the data, to analyze the data, and to share the data.
Fantastic answer. And I think on our program today, we do have a very strong network of doctors from different places. And before we close, I do want to end on a note for the future. Dr. Long, coming to you now. Looking ahead, what gives you most hope? I'm asking this on behalf of all the families of cancer patients who are holding on to that glimmer of hope that the future can bring to all of us. Why don't you share your thoughts with us, Dr. Long?
Yeah, I think in terms of hope in the future for cancer care, of course, what we're all trying to strive for is to cure cancer. And I think we have been making big headways in the last decade. And I think our experiences of essentially, significantly improving the survival of our patients because of new treatments, we've mentioned, for example, immunotherapy, new targeted treatments, and our understanding of the disease itself, the fact that cancer is very heterogeneous, they actually have very different biologies, and we have different ways of tackling each of these biologies now in our techniques of treatment, really is what we have. And with the employment of what we've discussed earlier, artificial intelligence, data gathering, collaboration, I think we can really accelerate this process and hopefully be able to achieve a cure. And I think what's most important is, treating cancer in its later stage is very difficult. But what we are understanding in all aspects of cancer, and not just sarcoma, for all cancers, is the importance of early detection and prevention. And if we're actually working on those two aspects for all our cancers, I think we can actually potentially achieve the dream of curing cancer as a whole.
Dr. Xie, what about you? Have you been able to tell your patients that maybe, just hanging there, treatment is on its way, maybe we'll have a cure in the future, just hang there? How do you see the future of cancer care?
I think the philosophy of every physician on treating cancer based on experience. And we need collaboration to get together all the physicians' experiences together and share with each other about the knowledge. Because how you recognize this disease decides how you will treat it. And I think that's one thing I learned from ESMO-SAC, from the youngsters investors class. They have a discussion that there's no excuse for you to not involve into collaboration. We can learn this disease more, then we get to know how to deal with this disease more. So that's a cycle, one lock with another, and it's all together. So my thing is, we want to more things, more knowledge together to shape up our philosophy on treating cancers so as to cure them more.
Beautiful,
That's my thing.
Beautiful message. And Dr. Strauss, there's no such thing as too much hope or too many hopeful messages. Can we get some from you as we wrap up our program today?
There's no such thing as too much hope, definitely. We're all sitting here optimistic that we're going to make big changes. I think we do need to slightly counter that with it's going to take some time. Particularly for sarcoma, it's a complex illness with many, many subtypes of it. But absolutely, there's a lot of hope here. And I think just us being here today and sharing this opportunity with our Chinese colleague can jumpstart that even more. I mean, we've been so impressed. I just want to put a shout out to our colleagues who are on the panel here. Wonderful collaborations that have been set up, and really I think that is going to make big strides forward for us all going forward. So I just want to thank you for giving us all this opportunity as well.
Thank you for participating. Appreciate it. For your generous sharing, for your wonderful knowledge and inspiring experiences. We began this conversation by asking, how can innovation and humanity come together to improve cancer care? And over the course of our discussions today, we have heard not just a medical insight, but truly human stories, inspirations from the physicians and doctors on the front line of curing cancer around the world. The voices from China, Europe, and across the globe remind us that cancer does not recognize borders, and neither should our fight against it. We appreciate the current and existing international collaboration in finding a cure, in finding better cures for cancer, and we certainly look forward to more in the future.